A very good morning to you. Thanks for joining us for our event today, focused on the very important topic of digital health in the NHS, delivered to you, our valued audience, by National Health Executive. A huge welcome is joining for the first time, and hello to those of you who join us every 2 months. The National Health Executive is always keen to deliver content which inspires innovation on the platform long after the day has finished. Today's event will be packed with opportunities to network and acquire more current sector knowledge. So I hope you're looking forward to what we've got in store. We must thank the industry leaders and experts who have taken time out to join us to share their high quality insights. And due to the standard of content which will be shared on our NHE365 platform, it is worth me pointing out that all of our content is CPD certified. So for every hour of content you watch live, you'll earn 1 CPD point. To receive your certificate, all you have to do is email the NHE team at marketing@cognitivepublishing.com. That's marketing@cognitivepublishing.com, and they'll sort it out for you. We also provide the opportunity to give back through some friendly competition. Whilst learning today, our gamification tools will be active. You can score points by engaging with the platform's different elements. Join a live session, there's 50 points earned. Make a connection with another delegate on the platform, 100 points. Ask a question in a session, which I hope you'll do, or engage with one of our exhibitors in the digital market space, another 50. You get the gist. At the end of the event, those who finish in first, second, and third places respectively will have 250, 150, and £100 to donate to a charity of their choice or receive Amazon vouchers. Of course, like anything, you can only be in it with a chance of winning by engaging with all of the great content we have to share with you and the other delegates. So please don't be shy. So there's a bit of background. Let's move to the focus of today. In October 2021, the government outlined an increase of £5.9 billion to the NHS budget and assigned £2.1 billion for improvement of software in digital healthcare. As technology becomes more critical in everyday life, the availability of digital healthcare has put innovation at the forefront of patient care, as conventional methods can lead to cost inefficiencies, missed appointments, and decline in patient health. This commitment from the government has firmly outlined their technical ambitions for the future of the NHS. Evolving the effective running of NHS practices via digital pathways will relieve the pressure from GPs, leading to a higher quality of delivered healthcare, patient experience, and reduction in infection rates by removing the waiting room. As we become more reliant on mobile devices and instant communication, there's never been a better time to be involved with the development of new technologies and interfaces throughout the NHS. The Digital Aspirant Programme supports trusts to deliver improved digital capabilities across the NHS. 23 trusts joined the programme in February 2020, and now 60 trusts. £6 million of the funding, receiving £250,000 a year to develop and share digital strategies. And these strategies will all be key themes in today's conversations. We have great networking opportunities throughout the day as well that can be accessed via the speed networking function. And I encourage you to collaborate with your colleagues as another great source of education. This all plays a part in the community we're growing to extend the reach of knowledge and connections shared today, which can be accessed at any time to work with your busy schedules. Also on the NHE365 platform, access to a wealth of resources on our on-demand content alongside the digital marketplace, providing valuable expertise for you and your teams to digest at your leisure. Finally, do feel free to share your thoughts and experiences today across social media using the hashtag NHE365. That's hashtag NHE365. So, with the scene set, let's head into our first keynote of the day with Dr. Phil Waywell, Director of Digital Partnerships from my part of the world, actually, Yorkshire and Humber Academic Health Science Network. As Director of Digital Partnerships for the Health and Care System in Yorkshire and Humber, Phil is focused on ensuring data infrastructure and assets are used to their full potential to support decision-making, thereby improving patient access, experience, and outcomes. Phil has particular expertise relating to real-world evidence, information governance, and the operation of trusted research environments. So that's plenty from me. Let me hand you over to Phil Waywell.
Thanks, Helen. Quick check, can everyone hear me okay? Yeah, perfect. So good morning, everyone, and thank you, Helen, for that very generous introduction. As you rightly mentioned, there's a huge amount going on in this particular space, so today's event is especially timely as funding starts to flow through the system at significant levels, and there's a huge amount of targets associated with the various things that are going to be discussed today. So it's a real pleasure to be kicking off today's events. As Helen mentioned, I'm based up in Yorkshire and Humber at the Academic Health Science Network as Director of Digital Partnerships. And I'm going to take the opportunity this morning to kind of start the event with a few thoughts around how AHSNs can support many of the things that will be discussed today. And then I'm going to close with a couple of reflections from myself and things to maybe bear in mind as you engage with the other sessions today. So next slide, please. So for those of you who may not be familiar with the AHSNs, there's actually 15 of us across England, and we are very much the innovation arm of the NHS. We've been operating for several years now, and if we could just move on to the next slide. The shared mission across all 15 organisations is to develop and support healthcare innovation, which obviously is an incredibly broad remit, but we tend to think about three main areas of activity. So improving lives, so very much to Helen's point about patient access, experience and outcomes, and how innovation can improve those. But also perhaps less well-known aspects that we focus on, saving money, and now we're talking about money within the health and care system. Can we use innovation to redesign and optimize service delivery and drive cost savings within the health and care system? And then probably the one that's least well known, but we are making a huge amount of ground in this particular area, and that's our focus on driving economic growth. And that is very much linked to a widely acknowledged correlation between health and wealth. So if we can help grow economic activity within our areas and thereby create new jobs or secure current ones, the kind of logic is those people in those jobs are likely to have better health outcomes as a result of that. So we work across all of those three areas and very much focus on driving innovation within the health and care system. So next slide, please. Now, to give you a sense of the scale of the AHSNs as a network, so the figures on the slide that you can see now, which I won't go through every single one of them. I'm happy for my slides to be shared afterwards, by the way. I should have mentioned that at the beginning. So no need for furious note scribbling or screen grabbing. I'm happy to share the content. But hopefully these numbers give you a sense of the breadth and scale of the various impacts that all 15 AHSNs nationally delivered. And this is just 1 year's worth of numbers, and they're fairly representative. So if I take the number of patients there in the top left, almost 500,000 patients benefited in a number of different ways through the work that we supported. And then if we start to look at the bottom right of the slide, apologies if you can hear a bit of background noise. I'm in a very busy digital incubator here in Hull today, which is just filling up for the day. But if we could, there we go. So if we look at the bottom right of the slide now and the investment leverage by companies, again, we're looking, towards $500 million in 1 year, which is fantastic, and it really speaks to that health and wealth narrative that I mentioned. So next slide, please. Now, obviously, I'm based in Yorkshire and Humber, so it would be remiss of me not to shine a bit of a spotlight on what we've been doing in our region. So just to kind of dive into our numbers in a little bit more detail to give you a sense of what it looks like across our patch. So again, we've supported over 200,000 patients across our region. I'll be talking a little bit about some of that work in a few moments, kind of tying in with some of the key themes of today. And the one I will draw your attention to is the bottom left of this particular slide, and our AHSN in Yorkshire and Humber is leading the network's activity around reducing the environmental impact of the health and care system, and how innovation can play a role in that, either by reducing CO2 emissions directly or indirectly. And an example I'll give of that is we've done a lot of work over the last 12 to 18 months looking at reducing the use of blue inhalers, reliever inhalers for asthma patients. Those inhalers, when used, release a lot of CO2 and greenhouse gases into the atmosphere, and by reducing the use of those, you reduce those CO2 emissions, and that's the number that's reflected on this slide. That's just from one particular program called Sentinel. So that's the range of different impacts that we have as a network and as an individual AHSN. And the key thing I want hopefully you to take from this is our role is to help make these things happen and drive collaboration. So all the things that you kind of finish today's program thinking about, it would be great to do ... I'd really encourage you to reach out to your local AHSN to think about how we can support you to achieve those aims. So if we go on to the next slides, I'll start to bring some of this to life and tie in with some of today's themes as well. So if we take remote patient care and virtual wards first, which is obviously a topic of conversation for today, and we're really going to shine a light on the work of several members of our team, two of whom are shown on this slide. So Gemma leads our work in this area, and Nicola is one of the program managers who's also very active. So if we move on to the next slide. So back in 2020, NHS commissioned a number of programmes across the North East and Yorkshire and the Humber, very much in the remote monitoring space initially, and it's starting to evolve and grow into virtual wards. We had two particular priority programmes for Yorkshire and Humber, so focusing on care homes, and then, as I mentioned, virtual wards, so looking at long-term care. Apologies for the acronym, try to weed those out where possible. And also paediatric pathways as well. So if we move on to the next slide, and this is what the work looks like in practice. So we're working with a number of different providers who are listed at the top. So Taito Care, Docobo and Health Call, who may be familiar to attendees today. And we are working and building partnerships between those technology providers and a number of different health and care stakeholders across a wide range of different pathways. And we've set ourselves some fairly significant targets, we feel, in terms of the sort of impact that we want to have. So this year, by March 2023, we want to be working with 20 care homes and supporting nearly 2,000 of their residents. Those were our targets. And also to support the implementation of 2,000 virtual ward beds. And this for ICS colleagues is particularly important because all the ICSs now have targets in terms of the delivery of virtual wards. So where were we up to? So when the team reported at the end of last month, well, they'd already surpassed their target in terms of care home residents, and were nearly twice, or just over twice actually, if my maths doesn't escape me, twice the number of care home residents. And I think that really reflects the level of latent demand within the care home sector to provide these sorts of technologies to support residents in their homes. And we've got loads of fantastic feedback on this particular set of technologies. In terms of virtual ward patients, as I mentioned, that's something that we'll be working on throughout the year. We're building up steadily and we're confident that we'll hit our targets. I should have mentioned before we moved on, actually, it's slightly obscured on my version of the slides. I can see myself, but on the version that you will all receive, on the previous slide, there's a QR code in the top right-hand corner. If you follow that QR code, it'll take you through to our impact report, and there's a lot more detail about this particular topic, and there's a link in my final slide as well that you'll be able to use. So if we move on. And this hopefully gives you a sense of the scale of activity for that particular program. So what you can see here are the different technologies listed on the right hand side and the locations where they're currently being used. And our role, as I've mentioned, is to really facilitate that engagement. And as you can see, we've already got a lot happening across our region, and as a result of that, we've learned a lot about those technologies and how they're implemented. And we did a learning and sharing activity workshop on Friday, where we had 3 providers listed and a number of other vendors, and they each delivered individual sessions to ICS colleagues, talking about how these technologies could be implemented. And again, that's an event that we facilitated as an AHSN. So if that's the sort of thing that you're keen to think about doing in your regions to support your decision making, then again, do reach out to either ourselves in Yorkshire and Humber or the other members of the network. So moving on to another example that's hopefully relevant to today's conversations as well, a little bit later in the programme. So now we're looking at how technology can support workforce transformation. And this is another example of where that other members of the team have delivered. So Barbara is our programme lead for this particular area around workforce transformation, and Yara supported the work that I'm particularly going to highlight this morning. So if we move on. So as with so many different aspects of the health and care system, the COVID pandemic presented a number of challenges that colleagues reached out to us as an AHSN to support their response. And the one that I'm particularly calling out on this slide is work across West Yorkshire, particularly around the mental health trusts within that particular part of our region. And the COVID pandemic placed a huge amount of pressure on mental health service staff. And it really highlighted that the need for a better way of coordinating and deploying the work of staff across multiple different trusts, if at all possible. So that kickstarted a number of conversations that we were brought in to support. And after a fairly rapid round of discussions that we facilitated, the 3 trusts within West Yorkshire agreed to work collaboratively and try to seek technical solutions to create a staff bank. And through an open procurement process, Patchwork Health were selected as the provider. And if we move on to the next slide, you'll get a sense of what this means in practice. So the procurement activity occurred over the last kind of 3 or 4 months or so. So this program is about to go into delivery. And listed on the left side of the 3 trusts who are working together collaboratively for the first time in this way. And you can see that a number of different roles and post holders will have access to the technology and be able to flexibly select different shifts using the technology. So you can see kind of screen grabs and examples of how this works in practice. And this is really about making workload allocation as flexible as possible, which benefits both members of staff and patients, of course. So it's about getting, the optimal way of deploying staff within a very complicated setting. The role of the HSN in this particular example now moving forward is to evaluate the impact of that innovation. So what are the benefits that occur from the introduction of this particular technology and this workforce transformation? And this is a sample of a lot of work that we're doing in Yorkshire and Humber around workforce transformation, and particularly in close collaboration with colleagues at Health Education England. We're doing a huge amount around digital and workforce development in that space. So again, if that's something of particular interest to participants today, do reach out, and I'm happy to introduce you through to Barbara and her team are doing some fantastic work. So if we move on to the next slide. And I'm going to start to wrap up now because I'm mindful of time and you've got a very packed programme to look forward for the rest of the day. So I'm going to leave you with a few thoughts before I bring this one to a close. So As Helen rightly said in her very generous introduction, data is one of the things that I am particularly interested in. I come from a real world evidence background. And one thing that I would really encourage everyone to think about, as you pick up some great ideas during today's programme and you start to think about how you would implement those within your systems and settings, I would really encourage you to think about what does success look like, and how do we actually prove that it's been achieved? Because one of the biggest challenges I hear from colleagues at the moment is we're doing a huge amount of stuff, we're supporting a huge amount of innovation, but we don't really have the data to back up the claims around the impact of that innovation. So think about your data at the start, work with your colleagues in terms of data infrastructure and analysis to think about what that looks like in practice. Trying to do it retrospectively is incredibly challenging and often quite inefficient. So if you can do it at the start, that's fantastic. If we move on to the next slide for me, and pretty much my final one for today. So one of the other big things that I'm working on at the moment is, so I'm a firm believer that collaboration between health and social care organisations and commercial partners is going to be a really important part of digital transformation moving forward. And by this, I don't mean a kind of traditional kind of transactional relationships where a vendor, sells you a technology and they kind of leave you to it, maybe provide a service package around it, and that's the only way you kind of have a relationship with them. I'm thinking much more collaborative, joint development of technologies that really reflect the needs of systems and providers. So that's the sort of partnership I've got in mind. I'm working with a number of colleagues across the Yorkshire and Humber and nationally, looking at what a blueprint for this sort of partnership could be. And I'm really keen to hear the thoughts and opinions of whoever would find this particularly relevant. So there is an open invitation to come and join those conversations, and let's think about what best practice looks like for partnerships. And on that note, brings me to my final slide. And if you would like to follow up with that invitation and hear more about that work in particular, do contact me. I've realised I'm keeping you on your toes today because the S and the H in that email address need to be the other way around, which is my fault. So apologies for that. I'm sure my correct contact details will be available somewhere on the platform. And as I mentioned a few moments ago, the QR code in the bottom left-hand corner, if you follow that code, it will take you through to our impact report for Yorkshire and the Humber, and it will really bring to life both the couple of examples I've had time to highlight today, but also the much broader range of work that we're doing right across our region, delivering those impacts that I showed a few moments ago. So that's everything for me. I think I've even managed to stick to time, which is fantastic. I really look forward to any future conversations that come out of today. And I'm sure you'll all enjoy a fantastic day of high quality content. So back to you, Helen.
In Yorkshire and Humber, but also, what you're thinking nationally as well. And I think you were perfect to kick off this conference, giving your details there. Is really the essence of what we're trying to do, Phil, building a community. And so to put your contact details there and invite people to collaborate is definitely what this event is all about. So thank you, Phil, for such an insightful keynote to start us off and leading us seamlessly into our panel discussion on clinical communication and collaboration. Now then, if you have any questions you'd like answered by our panelists, please do use the Q&A function. And once we get going, I'll put some of those questions to our guests. So if you see me looking down at the bottom of the screen, that's what I'm doing, checking to see if you put any questions in there. So if we can just go up a little bit, Zach, there. Using digital channels of communication between clinics and patients is vital to ensure an efficient and high quality delivery of healthcare advice and treatment. From March 2022, research suggested that 86% of UK adults own a smartphone, and as more traditional methods of communication become more obsolete, like landlines and letters, mobile applications and emails allow GPs and doctors to set appointment reminders, invites to screenings, and to give out test results instantly. Clinicians are now able to facilitate video and over-the-phone appointments to assess a patient if they're unable to get to hospital. The number of people on waiting lists to get a hospital appointment has risen to 6.1 million. The NHS will be more able to reduce the amount of those waiting as clinicians can communicate to cases and hold remote consultations for less serious cases. So it gives me great pleasure to introduce you to our first panel. And we have with us Andy Dylag, Corporate Sales Manager from EPOS Audio, Paula Baird, Programme Support Officer at NHS Scotland, and Alan Milbourne, Policy Manager for Digital Health and Care Workforce. So good morning to all of you, and let's see if we've got a full house there. Yes, we have got a full house. Good morning. How are you all?
Excellent,
Morning.
thank you.
Good. Let's kick off, Alan, with you, if we may. Can you talk about the impact of the pandemic, what the impact was on services and health and care?
The impact at the start of the pandemic, I think it's safe to say that it really forced us to rethink about how we had to communicate with our patients and service users, and also our internal communication routes across staff, clinicians, and in fact the whole entire workforce. I think until that date, it's also said to say that we had quite a lot of success in digital or different types of communication, blended approaches across the service, but the impact really forced us to really think that, because without having to have that on the table, those services, a lot of them would have just ceased to exist. So what we really had to do there was collectively think about how we can really ramp this up at scale. So that involved a lot of communication within boards. That was about getting staff to communicate with each other. So we rolled out we did a quick mass rollout of Microsoft 365, but of course that doesn't come without its challenges, because then we had to teach the staff how to use that. So it was all hands to the pump, and it was very quick, but I'm glad to say it was a great success, and we're still enjoying that success and scaling it up as we move forward. For the outward communication, we rolled out one of the main platforms, which was Near Me, which was enjoying some considerable success, but then this really had to go en masse. So again, there was a two-sided approach to that. One was to get the staff all equipped onto that, but also to encourage the service users at the other side. So there was two impacts, certainly, from the internal communication to the outward, in two ways. So it was a huge challenge, but I would say the impact for us overall, I could talk about this all day, is that it really put the digital agenda at the front of this, because I've been on this journey for a long time, especially on the digital workforce and skills and leadership side. So if anything, you could say the pandemic really gave us that front seat. So sometimes it's a bit of be careful what you wish for, but we are there now.
I can imagine, Alan,
how we sustain that and take that forward. That is our journey now.
It's key, isn't it? Because I can imagine it was all hands on deck, and seemingly the country did a very fine job of adapting very, very quickly, and probably a blessing in disguise in many ways. Obviously, the pandemic itself wasn't, but I'm sure a lot of those conversations that have been bubbling for a long time, and you probably had frustrations wanting to get stuff really going digitally, suddenly had to come to the forefront. And I'm just wondering, Paula, how digital perhaps helped some of the challenges you had to deliver at pace and at scale to patients and to service users. No mean feat, I wouldn't have thought.
Ultimately, we had to upskill healthcare practitioners in how to use Near Me for remote consultations, but that was also about, for citizens, how they were upskilled, because not all citizens are digital and some are actually excluded with devices. So it was how to deliver services remotely and at pace and scale. And not all services are delivered in a hospital setting. A lot is within care homes and in people's homes. So it was about how to get access to the relevant devices that could enable remote consultations. And that had to be done at pace and scale. But it was also how we could communicate across the health and social care partnerships, across the health boards, across care homes, and even within housing. And about how we rolled out Microsoft 365 practically overnight to enable access to Teams. And so that was done at rapid pace and scale.
That was all very impressive because, of course, the nation was also dealing with the actual pandemic and illness itself. So not a time when I would imagine staff have got a lot of free time on their hands to get into grips with something new. Andy, welcome to you to our conversation. Can you kick us off, just sort of setting the scene for us with giving us a sense of what EPOS does and what the last 2 years have been like for you?
Busy, in a nutshell.
That's the end of the answer. Busy, definitely.
Absolutely, yeah. So here at EPOS, we create premium audio solutions for both public sector and corporate sector users to ensure that everyone's got a device where they're communicating clearly, and really making sure that they're easy to use as well. There's nothing worse than, I'm sure Paula and Alan would agree, than getting a new device, trying to use it, and the learning curve is huge. We absolutely make sure that a lot of our devices are plug and play with all of the major platforms, and really make sure that, for NHS staff in particular, speaking to service users, they're coming through clearly, but also there's a huge consideration in terms of security with information governance, and making sure that it's just a seamless, easy, natural conversation experience via technology.
Yeah, and we've had 2 years, haven't we, as we've just outlined there, as Paul has outlined and Alan, of rapid development in I guess what you perhaps call telehealth solutions. But as the technology becomes more long-term, does there need to be much more investment in it now if this is to be the way forward, Andy, and we're to develop it in a way that I would imagine Alan or Paula will want it developed?
Yeah, absolutely. We're constantly developing our devices to ensure that users and service users find them as easy as possible to use, that they sit on all major platforms as well, and are easily deployable. We know that with the NHS, it can be quite hard with existing infrastructure to include new technologies in those, and we take that into consideration when we actually release our products, that they can fit with legacy systems as well.
Alan, can you talk to us about, at the beginning you said that was what happened in those 2 years, but the challenge now, I suppose, is to keep that momentum going. I'm just wondering what kind of digital initiatives have been implemented, where you are in Scotland, to help with communication and collaboration across the health and care sectors?
Well, just as I said before, we've got the 365 platform, and it comes equipped with learning resources as well. So that's there. That's been ingrained more and more across the service, and and been rolled out further, not just obviously across NHS, but right across health and care. So there is a very much collaborative approach across that, and obviously for the patients coming in, obviously NearMe is one of the main platforms. But where the angle that what I'm trying to get here, and based on what Andy is saying there as well, is that when we talk about the technology and the IT has been spoken about for a long time, and that's one side of this journey. The other side of it is the people and the user aspect of it. So while we're thinking about technology, IT, equipment, communication tools, all that kind of thing, what we're trying to get at is we're trying to understand what that's going to look like and what that's going to be, to understand a more streamlined approach, because we're trying to. What we have at the heart of this is our current workforce, our future workforce, our current users, our future users. So everything's going to keep developing. And as we know, I mean, I'm not a techie person. I'm a policy person, and it develops at lightning speed. So while we could talk about platform, they're always moving, they're always evolving, and the patients and service users, let's face it, are sometimes one step or two steps ahead of what NHS and health services are providing. So for us, that's the challenge. About it's not so much about what we're actually rolling out now. It's to keep that momentum going in that one step ahead, so that the two actually marry together, because this is just as much about people and the user aspect of it as it is about the IT and the communication tools themselves.
Alan, we've got a question which has just come in from Jane. Jane says, often in business cases, there are many benefits outlined. Have you been able to evidence many?
Can you say it to me again, Helen? Read that one out
So
again, sorry.
Jane says that often in business cases, there are many benefits outlined. Have you been able to evidence many?
In business cases,
So I suppose I suppose perhaps the any examples of the positives, I suppose, perhaps that have come out of what you've been doing, the transformation you've been going through.
I think without even fleshing out individual business, I mean, business cases would be, you know, would be for a central approach across our national services teams, and obviously they'd be adopted. You know, where there are many, there are local initiatives, there are national initiatives. You know, we've got the big systems there, we've got the smaller communication tools. So I don't think I'd be able to flesh out any individual business case, but I think if we were to look at one example, if you were to base it as a business case, if you look at the COVID proximity app, for instance, or the COVID testing app, that in itself, without even championing what that actually did and what that meant for people, you know, and their health and well-being, you know, throughout the pandemic, it shows us that the success of that was that people did adopt that at scale, and I bet you there was so many users that hadn't even heard of an app before. So there's a tried and trusted method of where we've managed to change that culture and moving forward. And that's something obviously that we're keen to do. It's a strange situation, because it's one of those situations where you could say, well, when people are forced to use it, you know, they have to use it, they will use it. And that's maybe the wrong angle, but it's true. When there's something there and it has to be done, you know, it can be done, and we have shown that. Yes, it comes with challenges, it comes with barriers, it comes with drawbacks, but on the whole, it is a success, and that's something that we need to keep sustaining.
And Emma just adds to that. Emma says there's lots of benefits evidenced from near me, e.g. travel time saved, which obviously is great, and that has a good impact on the environment too. Paula, I think Alan made a good point there. I mean, people are at the heart of this, and I think when we're talking digital, it's really important, isn't it, to remember that it's not just the workforce, the clinicians, it's also patients. And you mentioned briefly at the beginning about making sure that people aren't excluded. You know, not everybody's digital savvy, most people have a smartphone, but not everybody does. What did you put in place in Scotland to make sure that everybody was included and that nobody felt sort of left out by what was going on?
So that's about having digital champions within the workforce, but also within communities, and working with our health and social care partnerships who have developed sort of digital champions networks in the communities, but also ensuring that the support in how to use the technology was easy, accessible and simple and easy, and that it's okay to ask questions, and changing that culture to say, actually, I don't know how to do that. Can I have help support? And actually, there's been a number of user surveys undertaken around the technology just to get that feedback and then develop the resources and support. And even when we sort of talk about the success of technology, and that even with Near Me, leading up to COVID, I think that it was used about 2,000 times a week. Then through COVID, that increased to about 20,000 appointments a week. So that sort of shows the transition and adoption of technology. And Near Me is also moving into sort of how to support mental health with CBT, but also about having sessions that are just not one-to-one, where you can bring a CBT group together using Near Me technology. And even the examples about instead of people traveling a lot of miles and taking time out to see their skin specialist, that they could do that remotely as well. So it's about how not only do we use what we've learned, but also how we leverage and continue to build on that.
Andy, presumably working in the healthcare space, there are some unique considerations to take into account, I would have thought, when designing and providing solutions for this particular industry. Can you talk us through any of those?
Sure. Rather than having unique considerations, the healthcare industry really amplifies certain considerations. The confidential nature of healthcare means that devices do need to have the most recent security measures. So, for example, the headset that I'm using at the moment it has an ultra noise cancelling microphone and firmware called Own Voice Detect. So when being used in a busy office, it's not picking up anybody else's conversations, and maybe confidential information isn't being shared across calls. I'm sure we've all probably called a call centre once or twice, and you've heard other people in the call centre and thought, this isn't the the most secure conversation, and also they're not using an EPOS device. Similarly, devices need to be easy to use for everyone working in healthcare, whether they're admin staff or healthcare professionals as well, and depending on their experience with technology too. You know, we talk about now people being digital natives entering the workplace, and these are maybe people who have grown up with technology, with iPads, with devices, and they know how to use them really easily. They can be fine with technology, but there's, you know, still some people in the workplace who technology is relatively new to them, or the rate of technology changing can be quite hard to keep up with. You know, we all know that the latest phones and gadgets come out and you think, oh, wow, you know, this is something exciting to use. So we know that different users have different technical abilities, and, you know, we really strive to make sure that our devices are usable by all, but also contain the latest technology to make sure that they are secure and clear for communication.
My top tip is to have a 13-year-old who's head of tech in my house. He's made me a bit lazy, actually, because he's so good at it. I've been a bit naughty and not really got to grips as well as I should have done. Andy, Chris asks, and I'm just wondering whether you might feel this is appropriate for you to try and answer, and if not, perhaps we can put it over to Alan and Paula. But Chris says, with the speed of the growth of virtual wards, telehealth, etc., how have you met the challenges of not creating yet more silos of data and ensuring the data is easily available by clinicians without the need to log into more systems? Is that something you feel you can talk about, Andy? Does that fit with what goes on when you're designing?
It doesn't exactly fit in terms of service users and patients with our devices. What does fit, however, is that, so for an NHS hospital, trust, etc., CCG, who have maybe deployed our headsets to all their users, and I know that my local trust, you know, Northants NHFT, is absolutely huge. It can be very hard to keep track of what headsets have been deployed, you know, what devices have been deployed across an organization, and where that investment's gone as well, because these are our devices which can easily disappear. We actually have a piece of software called EPOS Manager that allows IT staff, admin staff to asset track all their headsets. So Andy Dialag's got this headset, Helen Fosboro's got another headset, Alan Milbourne's got another, etc. So they know what's been deployed. From there, they can also push firmware updates, because, for instance, Microsoft Teams has regular quarterly updates, and sometimes that can cause not an issue, but maybe a performance bug with a device. So they can push that out quickly and easily. And that software is actually free as well. So we don't charge for the use of the software or any of the data hosting if an NHS trust or user decides to keep that data in the cloud. It's all kept on Microsoft's Azure servers, which we know are super secure, but it can also be used as an on-premise piece of software as well. So a trust or a hospital could keep it in their data centers, and we don't charge for it at all. So it's a really nice way of an end user keeping track of exactly what they've bought, where their investment's gone, and then keeping them up and running for the life cycle of the product as well. Chris, I hope that helps.
Oh, well, I just wondered, Paula, you were nodding there. Do you want to add at all to that, add at all to what Andy said there? So it's basically, you know, meeting the challenge of not creating more and more silos of data. So making it easy for the clinicians to log on to a system without having to go into lots of different areas, I think is what Chris means there.
There's a lot of work going on about how we get onto sort of one platform, one system. We're also working with Scottish Government on the development of our data strategy, which will give guidance and commitments around that. We're also developing our specialist workforce, like our digital and technology workforce. And I think it's about looking at all of that. And what we talk about is, what's our technology roadmap and where's the data? So it's that balance of people, process, systems and data. So it's actually looking at what that roadmap is and how to get information easily flowed. Ultimately, it's about how to move off of paper and get the information that's on paper into systems. That's what the focus is and needs to be. And that's what will help transform services as well.
Alan, Tracy's just said that how can you evidence that patients are happy with the new forms of digital engagement? Have you had any feedback or done any surveys in Scotland to see, you know, what the patient reaction is and whether on the whole people are comfortable with the new, you know, the new ways?
There have been, I mean, my area is very much on the workforce side of it, but on the other side, on the patient side of it, there have been a number of surveys, you know, pretty much more done through the technology-enabled care side, you know, through the Near Me side. So we are aware that those challenges, if you like, are being met. I mean, we are getting really good feedback and we are getting really good uptake on that. It's just really how we actually streamline it and sustain it, you know, and make sure that it's actually business as usual for, you know, for our patients and service users. So there is quite a wealth, a decent feedback coming in on those, and given the sheer volume of the usage of it speaks for itself, really.
Yeah. I've been actually monitoring, not that this is about me, but I've been monitoring my blood pressure for the last 2 weeks remotely because I get white coat syndrome, and it's fantastic. It means I don't have to go in. I just sort of check it at home, pop it on an email, and it's much less stressful. Alan, tell us a bit about the Building Digital Skills and Leadership Programme and how that's enabling communication and collaboration across the health and care sector.
The actual programme itself, I mean, that's been on the table now for about 5 or 6 years, and I've been on that journey right from the beginning. But to cut a long story short, I'm glad to say it has got some great investment in it now. Obviously, as I said before, the pandemic has given us a leg up in that area, if you like. So the actual programme of work itself, we have a permanent team now, which sits centrally to this, which Paula heads up in NHS Education for Scotland. We have investment in that team. So rather than, you know, all the scoping that we did in the past and, you know, and talking about what we're going to do, we really are delivering on this. So rather than, you know, come with concepts and stuff, we are taking things in bite-sized chunks, making it practical and really demonstrating that we can deliver. Obviously, the pandemic has, you know, kind of led away from us at the beginning, but we have moved quite a lot in the last 18 months. And I will safely say that in the last 18 months, we have achieved so much more than we had in the last, say, 3 or 4 years, because we are managed to deliver and really tap into stuff at scale. So we have funded programmes in place until June 2023, which obviously is only around the corner. So obviously we do need to keep thinking ahead as to how we can really push that forward. So it's an agenda that's there. It's a programme there. It's pretty much there to stay because it is a fundamental piece of the health and care transformation, and it encapsulates a number of programmes around, you know, training and development and skills for 4 main pillars, which is our general workforce, which is all the workforce across health and care, our specialist workforce, which Paula touched on earlier, around our IT workforce, our security and data workforce, our leadership programme, which takes in all leaders across health and care. It's not just leaders at the senior level. It's all. We have had a great track record of leadership across our nursing and midwifery and allied health professions over the last few years. That's now been expanded. It's right across health and care, and it has other staff groups on it now. But of course, we are looking at the more senior leadership and clinical digital leadership as well, because these two sides have to fit together. There are some bottlenecks in the services, we know, with leadership, and how we transform that is very much on the table now. And last but not least is our future workforce, which obviously is our current workforce as well. How we can look at the education pathways, what the new blood means coming into health and care, and that's about, you know, trying to get a handle on what is coming down the hill, and what we really have to compete with and achieve, and really push the workforce for health and care into the front there, so it competes with all the private sector as well, because obviously these jobs are very similar, but as we know that there are differences across different organisations. So there's a huge agenda of work there. But last but not least, what I will say is, because we have this programme of work, it is very central to what we do around the digital health and care strategy, because it really takes in the people aspect of this.
You mentioned, Alan, leadership there a few times, and I know leadership, Paula, is something that you feel is very key to the success of all this, isn't it?
Leadership underpins everything from the boardroom right down to people that are just moving into leadership, supervisor, management roles. Ultimately, it's about leadership enables that transformation, and it's about how to skill up leaders so that they're able to make the connection of where the gaps are, that technology could be improved to deliver services. We're doing work, we're looking at masterclass for exec, non-exec level, and that's about where boardroom members think differently. They think with a digital mindset, and they also think through 5 lenses. It's about the people and culture, about digital innovation, about finance and efficiency. And then it's we've got different programs. So we've got a digital leadership program that runs with about 75 people per cohort who are sort of mid-level leaders across the sector that have all got digital projects. And it's about how we support and enable them to deliver those projects. And also it's about how we widen that, how we reach leaders at all levels, and how instead of it being digital leadership, it's just about leading in a digital age. And what are the core competencies of a leader in this age and going forward, and how we embed that throughout.
Andy, just wanted to touch, you did touch briefly on security concerns. You're handling sensitive conversations are being handled, confidential information. Are there any sort of concerns that we need to think about, or how much thought goes into that when developing at EPOS?
So you're absolutely right. Security is always at the forefront of our minds across our entire device range. Healthcare professionals and patients need to know that their conversations are secure and that our solutions are protecting the patient's personal data. Like I mentioned before, a lot of the devices that we recommend for healthcare professionals have security measures such as noise cancelling microphones so they don't get that bleeding conversations that I mentioned before. But also with the wireless headset that I'm using, for instance, we put in features like pairing intrusion protection, and encrypt our headsets as well. So we have a headset with a base station, and it's a monogamous relationship, which is protected by an 128-bit encryption and signed off by a wider wireless security forum as well, to really make sure, these headsets can't be wirelessly hacked and somebody could listen in to someone else's conversation.
Yeah, we heard a bit of a conversation going on in the background.
Absolutely.
I'm not quite sure whose conversation that was. And just a final thought, Andy. I mean, alongside telehealth, do you think that video conferences perhaps have a wider and long-term role to play in health and the administrative side of things, working alongside hybrid working, for example?
Yeah, absolutely. In terms of telehealth and hybrid working, like all sectors and organisations at the moment, everyone's reassessing their estate and who they've got coming into their buildings and what's coming into their buildings as well. I think it's really important to highlight it's a win-win for both the NHS and patients, as by putting the right technologies in place and opening up more space in buildings, there can be more space for patient care, but also cutting back on space that organisations have no use for anymore due to hybrid working.
And just a final thought, Alan, no pressure, but the final thought goes to you. How optimistic are you about the future? I mean, you've obviously had massive change over the last 2 years, exciting change and very speedy development. How optimistic are you feeling about all this change over the coming years?
Very optimistic, but I could be quite a cynical person, so I always err on the side of caution as well. But I think the main challenge for me is that obviously, a lot of this takes investment and it takes money, and that's what people seem to have this perception, and I support that. But it also really supports a different way of working, and it's shown that we can do that. So it's about people collectively coming together and collaborating. Now, there's one thing quickly. There's one slogan or term that we used to use all the time, and we used to use this digital first approach. Now, that's fine if people understand what digital first actually means, but we've kind of moved on a bit from that now. We're much more into a blended approach. So that's about learning from the past, looking to the future, and seeing how digital can complement, some of the tried and tested methods of communication or ways of working or whatever you want to do, and really bringing them together so that you are getting the balance of good on both sides. So you're not deliberately running down a digital route because you can or you have to. It's just really about making both ends work there. So it is very much a blended approach to this.
Well, that was a very optimistic note to end on, and you rose to my challenge beautifully. So I'd like to say a massive thank you to all of you, to our first panelists, to Andy, to Paula and Alan, for getting the day underway with some great conversation there. We're going to take a quick break now, time to digest even what's been covered so far, and a lot's been covered so far. So if you have chance, do engage with the speed networking functionality. Perhaps use what you've learned as a bit of an icebreaker. Well, let's meet back here in 10 minutes time.
Thank you.
Okay.
Thank you.
Thank you very much. That was a very